Honorable Vice Chancellor, sir, respected distinguished guests, scholars, and valued participants. It is my privilege to welcome you to the inaugural program of the Northeastern Regional Conference on Demography, Health and Development, Insights from Northeast India, jointly organized by the Indian Association for the Study of Poverty and University, Sikkim. This gathering marks the beginning of the 2 days meaningful dialogue and knowledge exchange. Let us commence with your kind attention. We are honored by the presence of Professor C.H. Satish Kumar, sir, Honorable Vice Chancellor, SRM University, Sikkim, Professor Suresh Sarma, President of IASP, Dr. Ajay Kising, Joint Secretary and Regional Coordinator, IASP, Dr. Anil Chandran, General Secretary, IASP, Dr. Jasendra Yadav, Treasurer, IASP, and Professor Ravi Verma, Executive Director and Board Members of ICRW. Let us all welcome them with a warm round of applause. To begin our proceedings, we invite the President of IASP, Professor Suresh Sharma, to deliver his welcome address. Please join me in welcoming him.
Very warm welcome and so very respected Professor C.H. Satish Kumar, Vice Chancellor, SRM University, Professor Suresh Sharma, President ISP, Dr. Thomas K. Thomas, Toby and Professor in charge, SRM University, Dr. Anil Chandran, General Secretary of ISP, his own time now, Dr. Jasendra Yadav, Treasurer, ISP, Dr. Ravi Verma, Executive Director of ICRW, Dr. Guest, and Dr. Ethan Singh. We are really privileged to welcome all of you here for a important regional conference that brings diverse participants to reflect on the intermovement and needs of demography, health, and development in Northeastern India. This region, with its rich cultural tapestry and strategic importance, presents both opportunities and persistent challenges, particularly when viewed through the lens of population dynamics and public health. Let us begin by acknowledging that Northeast India, home to about around 45 million population across 8 states of India, is marked by heterogeneity in fertility rates, health indicators, and migration patterns. Today, I want to draw our attention to 3 pressing issues that warrant deeper deliberation and collaborative actions. While India as a whole is witnessing a demographic condition with fertility rate declining in several northeastern states, which remains above or around the national average. If you look at NFHS 5 data, the national TFR is now at around 2.0, but in states like Meghalaya and Mizoram, which has like 2.9 and 2.6 of TFR, which is again very high when you compare to national average. In Assam, the TFI stands to at around 2.1, which is just at the adjustment level. Sikkim, on the other hand, presents a unique demographic picture with TFR of 1.1, which is among the lowest in the country. It indicates that the aging population and highlighting the needs to plan the future labor shortage and better care. One contributing factor to high fertility in some states is early marriage. Many of the states of northeastern India, including Assam, where the early marriage rate is around 33%, which is way above the national average. And then also, this is very high in the rural community as well. The early marriage is not very high in Sikkim, but it still stands at around like 40%. I think then we suggest that education and awareness efforts may be positive results of the initiative. Closely linked to this is the maternal health. While institutional deliveries have improved across the region, maternal mortality remains a concern. Assam, for example, has recorded maternal mortality of around 195 per 100,000 per according to SRS, but and which is significantly higher as compared to national average of 97. Whereas Sikkim has a better results with like more than like 100% of its babies, and and more than 86% of women receive like 480 etc. Compared to in Assam, which is only 63%. One of the alarming concern in Northeast region is also human trafficking. The deal of girls from economically disadvantaged communities in Assam and West Bengal. The NCRB reports that Assam ranks among the top 5 states in reporting trafficking. These crimes are often linked to unsafe migration, lack of livelihood options, and child marriage, only for urgent multi-sectoral intervention problem. Migration, both internal and cross-border, has long shaped the socio-political and economic landscape of Northeast. Assam and Tripura have witnessed high volume of foreign migration, which has influenced the demographic competition and strained public sources. At the time, Sikkim, Manipur, and Nagaland are seeing an increasing migration of youth to metropolitan cities for education and employment. In Sikkim, this trend is more pronounced in educated youth, which results in skilled workforce drain and a growing concern around brain drain and wisdom development. Also, issues are communicable and non-communicable disease in Northeastern India. Which is like a very prevalent in states like Sikkim and also Nagaland and Meghalaya. So to sum up, the Northeast region is at the critical juncture. The interplay between population dynamics, health outcomes, and development pathways presents a complex and often very overlapping challenges. But it also offers us vital opportunities to craft inclusive, context-specific data-driven strategy that are our communities. So this conference is essentially in state tech diversity. And next 1.5 days, the latest use this platform to share innovations, identify gaps, and commit to actions that is locally grounded and locally aligned. So with this, I welcome you once again. Thank you again.
Thank you, sir. May I now request Honorable Vice Chancellor, sir, and all the dignitaries to ceremonially inaugurate the program by lighting the ceremonial handle. We're privileged to have such distinguished guests with us today. May I request Honorable Vice Chancellor, Sir, Professor C.H. Satish Kumar, to honor our dignitaries with the traditional khadas and bouquet. Professor Suresh Sharma, President of ISP. Dr. Ajay K. Joint Secretary and Regional Coordinator, ISP. Dr. Anil Chandran, General Secretary, ISP. Dr. Jasindra Yadav, Treasurer, ISP. and Professor Ravi Verma, Executive Director and Board Members of ICRW. Thank you, sir. We now invite Professor Suresh Sharma, President of IASP, to felicitate Honorable Vice Chancellor, Sir, Professor C.L. Sadish Kumar, in recognition of his visionary leadership. I request Honorable Vice Chancellor, Sir, to felicitate Thomas K. Thomas, Sir, Registrar in charge of SIM University, Sikkim, and HOD of Department of Public Health. Thank you, sir. Provide context of our discussions, I now call upon Dr. Ajay K. Singh, Joint Secretary. Sorry for the error. We are honored to now hear from Professor Suresh Sharma, President of ISP. Sir, please share your valuable perspectives with us.
Morning, everyone. It is my great pleasure to welcome you all to the Northeast Regional Conference of the Indian Association of the Population Study, jointly with the SRM University. Today we are gathered for next 2 days for eagerly, deeply, and with the theme of demography, health, and development insight from the Northeast India. With our current challenges and aspiration of the field of population study. Let me begin by thanking leadership of SRM University of Sikkim. I am grateful to the Honorable Vice Chancellor, Professor Satish Kumar Chaudhary, for hosting this event and for the excellent support by the university, faculty and staff, and Professor Thomas and Dr. Kinkar Manda. I am also extend the special thanks to my colleagues, Dr. Ajay Kumar Singh, Joint Secretary of Regional Coordinator of the IASP, for this initiative and coordination is bringing this regional conference to the virtual, to our distinguished guest speaker and panelists and paper presenters. I offer warm welcome. Your presence contribution greatly enrich this academic gathering. I would like to thank our fellow and colleagues from the IASP, Executive Council and Board of Trustees, Dr. Anil Chandran, Dr. Ajay, and Dr. Jitendra Yadav, for their unwavering commitment and advance for the association mission. I also thankful to my senior and mentors, Dr. Ravi Verma, Dr. DPC, and Dr. N.S. Best, for their presence in this conference. And I would like to make a little bit about my IASP association. The IASP, Indian Association of the Study of Population, it was established back in 1971 at the Institute of North Delhi. Over the past decades, it has grown to the one of the most reputed professional body in the field of population study and demography in India. The core mission of ISP has always been promoting high quality of academic exchange, encourage the research that relevant the policy and build up a strong collaboration with the research institutions and policymakers. It brings together professionals from the diverse fields such as demography, public health, and economics, sociology, and statistics, creating a truly interdisciplinary platform. Today, ISP has more than 1,000 members from across the India and other countries. These including researchers, academic students, and government officials and practitioners working on the population and the health related issues. Our one of our key activity of annual conference, which has been held 45 times so far, different part of country. These conferences provide the excellent platform for the researchers to get their work, engage in the discussion and network with other fields. In additional national conference, ISP also hosts the regional seminars, workshop and training programs, lecture to promoting capacity building, dialogues at the state and national level. ISP also committed to supporting young scholars through the essay competition, award and travel grant, the special session at the conference. During my previous term as a president of ISP, we initiated the regional chapters in Jammu and Kashmir, Assam and Tamil Nadu, and Gujarat and Odisha to decentralize our efforts to better address the local population issues. We also introduced the two important awards to encourage the recognized excellency, like Professor Sudesh Nadia Essay Award for inspire the young researcher for demography. The second award, the Professor P.P. Talwar for the women in technical demography to celebrate the women leadership and scholarship in our field. Now I am going to come into the main theme of the conference, like demography, health and development insight from Northeast in India. As we are gathered here, we must recognize the while Northeast represent one of the India's most culturally rich, ecological diverse regions. It is also reflects some of the most complex development challenges in our country, demography and public health landscape. Northeastern region comprising 8 states like Assam, Arunachal Pradesh, Manipur, Meghalaya, Mizoram, and Nagaland, Tripura, Sikkim. Account roughly 3.8 of the Indian population, with the more than 45 million people. The region is home more than the 200 ethnic communities, many which are constitutionally recognized as civil. The demographic fabric is the market by the low population density, diverse fertility and mortality pattern, significant cross-border migration and higher literacy level, particularly among the women in some of the states. Yet, this is the positive exists the persist cultural structure. Look at the demographic and health challenges in Northeast, like fertility and population growth. The state like Nagaland and Manipur have fertility level above the replacement level, while Sikkim and Arunachal are witnessing the declining the fertility. The migration pattern, both in migration pattern from the Bangladesh and internal out migration due to lack of employment, are shaping population dynamics in urban states. Second, like challenge maternal and child health. The maternal mortality ratio in Assam stands in 195 per thousand. Live birth SRS, like based on SRS 2022, significantly national average of 97. The institutional delivery and antenatal care services remain weak in several tribal areas due to geographical inaccessibility and cultural discount, fitness, health services, and local community. The third challenge is in nutrition and child development. According to NFHS 5, some of the states like Meghalaya and Tripura, over the 30% of the children under the 5 are stunted and more than 20% underweight. The anemic prevalence among women remains the alarming high across the region, particularly adolescent girls. And another challenge is maternal health and substance abuse. The region faces the silent crisis in maternal health, with raging cases of substance abuse among the youth, particularly injectable drugs and states like Manipur and Mizoram. That maternal health services and the addiction facility grossly indicated and accessible inaccessible. Another challenge is like non-communicable disease. At the rate of related diseases like diabetes, hypertension, and cardiovascular disease is being observed, accelerated by the poor dietary and the diversity lack of awareness. Look at this, gap and policy implication in northeastern region. Despite the luminous central scheme like NHM, Poshan Abhiyan, and Ayushman Bharat, implementation of the Northeast has faced the regional confidence constraint, like centralized planning, poor contractual adaptation of the schemes, the insufficient human resources for the health, and with the doctors, specialists unwilling to serve the remote districts, in particular in Assam and other states. And limited community engagement, like talk down to the health messaging of filling the account of the local language and leave the customary practices. I think this policy recommendation for forward for the regional specific health planning, we can develop Northeast specific health and demographic policy to integrate geographical remoteness, ethnic diversity, and political autonomy. Encourage interstate coordination through the regional health system and strengthen the health infrastructures like focus strengthening sub-centers and primary health centers with a solar power and telemedicines and mobile health unit difficult areas. Enhance the capacity building the ASA worker and tribal health volunteer through the localized and culturally relevant trainings and invest of the human resources of targeting initiative monitoring and non-monitoring for hosting the special trained staff hilly and border districts. Collaboration with the local academic institutions to build a pipeline to train health professionals from with the regions. And another this culturally and sensitive programming, the incorporate dialogues knowledge system to the public health communication and service delivery, which also is very, very important. And data system, the research system, like invest the strengthening the civil registration system, vital statistics system, and support research institutions in the region for conduct district level survey for longitudinal studies like LASI, also is one of the large scale survey. Youth and livelihood integration, like demographic and health strategy with skill development and livelihood program address youth outmigration and economic marginalization. Today's discussion must be beyond analysis. They must help the rethink models, regional policies, and renew our commitment to the region people. I hope this platform will generate not only the new insight, but bold action rooted by people, evidence, and empathy. Over the next 2 days, We will explore the wide area of the issue like maternal health, child nutrition, morbidity, and migration, aging, and health system. All the view through the lean of the Northeast India, unique socio-economic, socio-culture, and geographical landscape. The insight shared the here, no doubt, guidance both scholarship and policy making. Now I am going to stop, but I would like to acknowledge my commitment, tireless but local organization team, Professor Thomas and Dr. Kinkar Mandal. I request you all the participants kindly get clear with both of them. And all the voluntary, and staff in SRM University for outstanding efforts and making conference possible. Thank you all once again for the presence and participation. Let us work together to the dialogues and to delivery. Thank you very much.
Thank you, sir, for your insightful address. It is now my great honor to invite to the podium our chief guest, the Honorable Vice Chancellor of SRM University, Sikkim, Professor C.S. Satish Kumar. Sir, your guidance has been invaluable in materializing this conference today. We would be privileged to hear your inaugural address.
So let me invite all the dignitaries for attending this demography, health, and government Northeast India, jointly organized by the Association of ASP and SRMs. A warm welcome to Professor Suresh, President of IASP, Dr. Anil Chandran, Dhirendra Yadav, Rajat Kumar Singh, and our own faculty on this most important my guru, Dr. Ravi Jagan. It's very, this conference became brought a lot of nostalgia to me. I met people, friends after 30 years and 25 years I think. Working together several years in the field of democracy. Before getting to the thing, let me talk about the SRM University. We have 5 universities in SRM for families and the massive universities. And we thought that we want to start a beautiful university here. And our management thought of having a hill station university and the corporation's responsibility. We came here. We thought that we would begin 3 years. Why I am telling you that how demography and how it linked to our concept of this problems of Northeast are different compared to major problem is one of the important thing is that getting into the place itself is a problem. Number one. Number two is that availability of the required manpower is another challenge for institutions like, especially institutions like the SRM and other universities. And only one of the important potential areas that people. Northeast people are humble and very polite and peaceful. Except a couple of things happened recently. And that's the biggest potential of the area. But the problem is how to connect them. It's a big problem here. We have been struggling to establish university in Sikkim. I'm here for the last 10 years almost. I'm the founding, I think I am the person who started. I've been sent here to establish the university. We're struggling and now finally we got the land is important. We got it, I think, another couple of years. We are going to have a beautiful university, small university here in Sikkim. Let us now stop. We thought that there was a lot of discussion happened at the strategic level. Shall we stop till we have a campus or start the university? So we went ahead, started 24 departments, 70 departments, 24 programs, PhD program, and one among those, my favorite school, School of Public Health. This is my second school to start School of Public Health. One we started SR University School of Public Health. This is the second one. And I have an initial responsibility of SRM Amaravati is an international university. There also we are talking to students of Columbia to have a collaborative School of Public Health there. So we want to connect all the schools and bring all these dynamics into one plane and work on them. So this is about the university. So similarly in demography also we have different issues. Whenever the demographic trend comes, even I have that, take out the analytics data, 5, 4, 3, 2, and take this line graph. Oh, these are the trends showing up and down and up and down. The Northeast is not one. Northeast itself is a mini India. It has a very developed states to the underdeveloped states actually, and different dynamics goes in in Northeast. But outside India, we think that Northeast is one. So, but it's not there. And another important thing that other than the traditional problems of fertility and mortality, they have a unique problem. Like I know that when I started my career as a public health researcher, we thought that important problem is let us will solve everything. We're taking the Kerala data and UP data and compare it. Let us see very high, and some other data somebody told that no. Women empowerment will solve the problem. I think we never anticipated that in Sikkim, we have highly empowered women status, we have high literacy, but the problems are having negative impact on the demography going to the low level of fertility. Not only that, this trend is happening all over Northeast, except in Meghalaya. I'm telling that if the people of socks and work on that, we will have a different type of demographic problem in Northeast. Another important thing, since being public health researcher, I my interest was public health. I think all of you have talked about that. Growing problem is that NCD. NCD is not only diabetic, the biggest problem we have 10 research projects in SRM cancer. And another thing, adding to that in Northeast, accessibility is a problem. The patient reaching to the cancer time is a big financial problem. Okay? We are doing a cancer economic study all over Northeast, and Tom is heading that into it. You want to see how much economic burden it implies on the families who have a cancer. Actually, in Kenya, so we take the catastrophe that expenditure. It has become a double catastrophe because of many other problems. So another important problem, very unique problem is emerging is that suicides. Youth suicides, even Sikkim stands first among all the Northeast states. And even India also percentage is much higher. Another growing problem, I think, might be because lack of opportunities, high literacy, and aspirations gone up because of social media exposure. I think that is leading to unfulfilled ambitions. All these things contribute to a different kind of problem fixing the brains of the youth. It's required an in-depth study of Northeast other than beyond the North and just 5 years. Required to do research. And what somebody touched upon the substance use is not injectable use. Different forms of substance use entered. The last 9 years, 10 years from here, I've seen these problems going up. Obesity is going up in Sikkim. Even though we see that people daily walk, we also had that experience of walking. So we don't have lifts. Even then, the obesity is going up in Northeast. And another important thing is that the substance use of other different types of substances in the country. Besides all these things, potential is in the people of potential in the culture of Northeast, potential in the availability of resources in Northeast. We have to develop an intervention by the developers. I think academic in the hands of researchers as well as academics to develop an interventions based on this to resolve those issues of Northeast. That is the biggest problem. And I also, when I came here, when I joined that time I came to start the university, I opened all the analytics questions, how the problem. It did be Rajasthan. I worked in Rajasthan I think around 13 years. So we have a problem of high home deliveries, high domestic violence. But yeah, nothing is there. Everything is 100% institutional deliveries, high interest rates. So there's no problem. There's no work for me. I thought that. Just said I personally added that talking to him, help the control. And now, one more thing we did in Sikkim, we removed the demography and we added tourism, health and development because there's the potential of Northeast. Now we have project on multi-dimensional tourism development project we are doing it actually all over the Northeast. Look at the various stakeholders, what are the resources, bringing community in tourism is not a cultural based, it is a very nature based, nature based. So involvement of community is very less. So how to bring the community as stakeholders? We are developing a multi-dimensional index for bringing the tourism development, not only demography. We have to bring demography, tourism, and health and that is I think next time when we have an opportunity we should work on. So thanks to Modi sir, I think he came to our state. I think I think one important thing that this current state, the government, central government, they have a lot of trust in Northeast and they have a lot of land at the front, lot of land of the area. Then many programs have started. Donor organization has been started. We have a lot of funding opportunities are there. Wrong availability of and willingness of the person to come and work in office. The big problem now currently in office is. And somebody talked about migration. Of course, migration when the dynamics happens, development dynamics happens, migration can take place. That's actually we are going to that phase of development dynamics are happening very rapidly in Northeast. So that in tune with that migration both in white collar as well as urban migration happening. There's also another aspect. I think we are also worried. I think it's worry for all of us. And sorry for that, because we try to avoid the date with Modi Saab to visit to Sikkim. Actually, it was planned for 22nd, somehow because of Sindhu, I think that we postponed to 29. So now I think it's an honor for all of us. We have complied with that. And with this biggest, because I want to talk to you, I think we'll be talking to you in everything, but I want to extend to my this is a small university. Developing university, the model of Northeast. If any inquiries are there, we are happy to immediately. Our team is there. We have a very dynamic, proactive team here, and they will be always on the course and they work on that. And please be with us. And we want to arrange a today evening sightseeing, but it never happened because we closed all the things. Tomorrow we'll try to do that. How to take them to afternoon, right? And we'll arrange without seeing Sikkim, should not go. We always say that Sikkim there's nothing to see. Sikkim will a lot of things to feel. The feeling of Sikkim is to go back. Thank you very much.
Thank you, Honorable Vice Chancellor, sir, for your inspiring and thought-provoking words. It is with great honor that I welcome you to the significant moment in our conference, the official release of the abstract book, a compendium that encapsulates the scholarly contribution and research endeavors presented during this conference gathering. To enlist the same, may I invite Honorable Vice Chancellor Sir and the President of ISP to do the honor along with the other dignitaries. There's also a release of some population-related books for which I request the dignitaries to do the honor, please.
Regularly being published in industry, but this time two special volume like sharing conference we have selected and whenever special volume from top conference. So Dr. Puneet has been here who are interested.
Thank you, sir. Our inaugural session to close, we invite Dr. Anil Chandran, General Secretary of ISP, for his concluding remarks.
Vice Chancellor, Satish Kumar sir, our Honorable President of IASP, Dr. Suresh Sharma sir, Dr. Ajay Singh, Dr. Jitendra Yadav, my colleagues at IASP, Dr. Toms, our veteran demographer, Professor Ravi Verma, sir, Disc sir, and sir. So, well, I mean, on behalf of IASP, I welcome all of you to this event. Already the welcome is already over, but still it is my privilege to welcome you all. In fact, before going into the theme of the conference, I would like to mention that, as President has already mentioned, IASP is the only national association of demographers in the country, and we have a membership of about 1,200, and the numbers are going up. And some of you are not members of IASP. I request all of you to become members of IASP. The membership forms will be available here. So please join the collective so that you can also be part of the events that are happening all over India on demographic issues that are taken up by IASP. In fact, we are conducting. President has already mentioned about the conferences that we are organizing, the annual conferences and the regional conferences. In fact, we just concluded one conference in the month of March in the NIT Hamirpur, the Northern Regional Conference, and we are coming to Northeast in sitting for the Northeast Regional Conference. Before this, we had the West, South, all other regional conferences are all over. Now we are actually getting it for the annual conference of 2025, which will probably happen in Kolkata. We are still working on the modalities and discussions are going on. So it will be sometime in November. So I request you to please keep visiting the IASP website, www.iasp.ac.in, so that you will get updates about all the events that we are conducting. We also have distinguished lectures happening almost every month on various issues of demographic importance. So I also request all of you to join those online lectures so that you will get to know more advancements of demographic issues in and around India. The good thing is that most of the lectures are delivered by faculty members from outside India. That is one of the things that we have taken into consideration, that we should know what is happening elsewhere, and people who are researching from other parts of India researching about India. So that is the purpose. So I would also request all of you to join those lectures. And this conference was actually announced in the month of February. In fact, much earlier than, before we went for the Hamirpur conference, we have announced this conference. We received a good response to the invitation of abstracts. In fact, we got about 100 abstracts. Some of them were not of interest to Northeast, so we have not selected many of them. Finally, we have selected about 50 abstracts of the 100, and about 35 papers are presented today on various issues of demography. We all know that we have already heard from the Vice Chancellor and also from the President regarding the demographic diversities of this region. So I think there are a lot of issues to be discussed. I don't want to go into much detail because we are at the far end of the conference of this inaugural session. I think that, and I hope that during the next 1.5 days. The conference will, discuss many of the issues that are, pertinent to Northeast, and we'll come up with some, ideas in the form of some solutions or, some ideas, so that, we will be able to, take the research further in the Northeastern region. So I welcome all of you once again to this conference, and I request all of you to be active in participating in the conference. Thank you so much. Thank you.
Thank you, sir. Now, as a token of our appreciation, we will now proceed with the distribution of mementos to our esteemed dignitaries, for which may I request Honorable Vice Chancellor, sir, to kindly present the mementos to the dignitaries. This is the traditional Buddhist kanta, which is one of the very traditional and holy gift that we offer to the guests who visit Sikkim. And that is this memento is called as kanta. Professor Ravi Verma, sir, also, may I request you to kindly come to the dais. To Dr. Puneet Ajay, sir, please kindly come to the dais. Thank you, sir. To express the gratitude to all who have made this event possible, we now invite Dr. Jitendra Yadav, sir, Treasurer of ISP, to deliver his vote of thanks.
Respected guests, dignitary and dear friends, good morning and namaste. On behalf of the ISP and Sikkim University, and on behalf of the organizing committee, I feel happy to bear the formal vote of thanks. So, first of all, I thank to Honorable Vice Chancellor, Professor Satish Kumar sir. So I know the capacity of sir organizing the conference. He has organized very big conference in 2007 in Saram University, IASS. I was a teaching member of the IASS at that time. I really thanks to Dr. Ajay Kumar, Joint Secretary, and the organizing committee members from the ISP side. And because of he started the dialogue with Saram University and organized the conference. So I really big thanks to Dr. Ajay Kumar. I really thank you to our dynamic president, Professor Suresh Sharma sir, for inspiring word and leadership to organize the conference. I special thank to Dr. Anil Kumar sir, General Secretary of ISP, to his hard work and cultural support. And I really special thanks to go to our thanks to Professor Ravi Verma sir, and not only physically, mentally, but also continuous support, the financial support for the ISP to organize the each and every conference, even annual and regional. Really thanks to our Vice President, former Vice President DP Singh sir, Professor DP Singh sir, Professor PHU, and Vishnu sir, and I really thank to many people from the Saram University. A special thanks goes to Professor Thomas sir, Tinker sir, Dr. Santosh, and all the staff and students who work behind the make the conference successful for the Saram University. So I request all the participants, एक बार खड़े होकर शानदार ताली होनी चाहिए हमारी पूरी ऑर्गेनाइजिंग टीम के लिए। बहुत मेहनत लगती है और हम लोग पता है कॉन्फ्रेंस कैसे होता है। और मैं कहना चाहे हम तो दिल्ली से आए हैं, तो हम लोग तो पॉल्यूशन का बहुत इंजॉय करते हैं दिल्ली में, बट आप लोग रियली ब्यूटी ऑफ द ब्यूटी ऑफ द recently, Tara University can talk and Sikkim for last coming 2 days. And we are going to have the annual conference as mentioned by Dr. Anil sir, 27, 28 and 29 November in Kolkata. So I requested all to visit the website and apply and enjoy the conference in the Kolkata. So I really thanks to all again. Thank you.
Thank you for your gracious words, sir. Before we proceed, may I request all dignitaries and participants to assemble for a group photo session to commemorate this session. We will then have a tea break of 20 minutes followed by Q&A session, the same venue. Thank you all for your participation. Let's now gather for the photograph. Dear participants, we have two photo sessions, first in this room, and then we have another photo session that we will do.